So I will start off with the question on everyone's mind, which is, what is the secret to living for over 100 years? Please tell us.
So what's your secret for living over 100 years? What's your secret for living over 100 years?
Clean living, it says here in small print. Yeah, just I exist, that's all. I'm doing fine though. I'm not sicker. I'm still piling up the months.
That's right.
That's what counts, I guess. So everything's been going good. Good for me. No complaints. Why?
Hard work.
A lot worse people off
Yep.
than I am.
Clean living and hard work, right?
Oh, yeah.
That sounds about right.
Milkman all my life.
And chocolate.
And chocolate. Yes, and any sweet.
So could you tell me a little bit about what role home health care played in Corky's care, and how you both feel about him having been able to receive care in the home, and how it helped both of your quality of life?
Oh, they've been great with us.
What about our team bringing medical care to him?
Oh,
what role do you think that played in taking care of him?
Probably a lot. I mean, it was 100%, because otherwise going out there and it was getting rough, taking him back and forth to the VA and trying to get his meds, but having him shipped to me, it was just awesome. And all the team has been wonderful. Yeah, there was the nurse that came out that would change his tubes and, do his vitals. They were there, every couple weeks. And then the home health aide that came and gave him a shower and did his laundry and, took care of him. He had to have lunch or breakfast or whatever. They would do all that for him because he couldn't do all that.
Right. And then we have a physical therapist on our team who would get equipment needs attended to without him having to come to the clinic to be assessed.
Correct.
And then a dietitian, particularly to help with food preferences and maintain healthy weight, social workers to help coordinate his care, pharmacists to help manage his medications. And then I was able to come see him both in your house and in the facility where he's living now.
How's their little one doing?
So we can share that my youngest daughter was born on Corky's birthday. So that every time I see him, that's what he's asking about in the background. Every time I see him, he asks about my daughter who shares his birthday. And you can assure him that she's doing great.
She's doing great.
Good dear. Good dear.
He remembers that's for sure.
So, right. So while his cognition has declined somewhat over time, there are definitely things he remembers very particularly, and he certainly associates every time I see him with my daughter's birthday, and knows to ask me. He also had a really dramatic medical event around the time of his birthday, 3.5 years ago.
Right.
Requiring a surgery, a huge abdominal surgery that he survived at age 97.
Yeah.
And so he's had a lot of events that have surrounded his birthday. But because of the care he's received at the VA and because of the care he's received with home-based primary care and his supportive home health aides and things like that, he did really well in recovery from that surgery, and had wraparound services and went to rehab and was able to return home. And I think is sort of an example of the ongoing and longitudinal care we've been able to provide for him, to honor his wishes, which is to not be in a nursing home long term. And so that has been a really big priority that you as a family have been able to honor for him.
Nancy, if you could tell us a little bit about some of the challenges that you had. You kind of touched on it earlier, but some of the challenges that you had when you were still going to the doctor rather than having home care services.
He was, at that time, he was a little bit stronger. He was actually a lot stronger. he could help himself get in and out of the vehicles. But that was the hardest part. I just didn't have the strength to pick him up, being that I have osteoarthritis myself. So,
But it just got harder over time to keep doing that.
right. After he had a stroke in July, that's when everything just kind of went, oh, I can't, he doesn't have any strength to pick himself up anymore.
Yeah.
He
has I think he's okay with us sharing this. He has a urinary catheter too. So
right.
It's that he transfers with a walker. He has, now severe debility and has a urinary catheter that you have to manage. And so and he's hearing impaired and he wears glasses. And so it's, as you get older, these levels of debility just sort of accumulate. And that just a simple transfer in and out of a vehicle, things we take for granted when we're younger and more able-bodied, becomes so much more complicated. And while our medical center in Ann Arbor isn't the biggest of medical centers, and we're not in the middle of a huge major downtown city, there's still a lot of transferring and a fair distance from the parking lot to any of the clinics. I think being able to bring all these services to him instead of having to ask family or assistance or pay for a ride or any of those things really improves quality of life, with the principle of whatever days 100-year-old has left, we want each of them to be meaningful, and not spent schlepping back and forth to a hospital or a clinic, or spent in a way that's uncomfortable or unpleasant. I'd much rather he sit in his recliner watching his TV, enjoying his chocolate, than spending it all day in and out of the car, transferring back and forth, trying to get to the clinic. And we've been able, to help do that, by the extension of the clinic in the home. And I think that that's the service. And what he's waiting for right now is this appointment with the hospice doctor or the visiting doctor at the facility, because he has since transitioned. While he is not actively dying, he is benefiting from this concept of more palliative care and home hospice services, to allow for this focus on comfort management, symptom management, and not a lot of intervening and aggressive medical care in his 101st year of life on this planet, and just being respectful of all of that level of care. And I get to just be along for the ride as a shepherd, helping to manage what I can, and just, keep him from any level of suffering, and prevent whatever it is that we can prevent. And so that's our role at this point. And I think, should we all live to 100, we all deserve that level of shepherding, and assistance. And I think that's our role in home care at this point for him.
Yes, I think so too. Yeah, I think that's the best. Like I said, he's been doing great.
At his age and debility, the biggest thing we think about is falls. The biggest issue for him and my biggest concern as his physician is making sure that he doesn't injure himself, or suffer an injury because he's not supervised in his movement. I think that's the biggest thing we worry about. I think that's probably Nancy's biggest concern is just, you can see he's in a nice apartment with a couch and a recliner and a little kitchenette, and he has his own bathroom and his own bedroom, and we just want to keep him there and keep him safe. Honestly, at this point, his medical interventions are pretty minimal. So I think, just keeping him safe, and fed with chocolate. Our team brought him a bunch of M&Ms for his 100th birthday, and that's all he wants now.
Yeah, he's actually any kind of cake.
Chocolate.
Yeah, may we all just eat a lot of chocolate in our 101st year.
Comfort, safety, and chocolate. That sounds like a good focus.
Who needs food?
So, Dr. Markovitz, if you don't mind me getting a little personal, I have heard that you have said that home care saved your career. Is that something you want to talk about at all? Is that something you can explain?
So I have shared before with the Academy and with others, that I actually trained in internal medicine and pediatrics. I'm not a geriatrician by training. I did anticipate taking care of full spectrum of adults. I worked for the Indian Health Service before returning to the VA on the Navajo Reservation, and I found that work and taking care of adults there, full spectrum of care, inpatient and outpatient medicine, very rewarding. And when I came back to the VA and took on a full primary care panel, the busyness and the grind, and never having a moment to really breathe and think about improving care or improving systems of care was really challenging for me. Our home-based primary care program hadn't had a medical director before I was hired into the position about 5.5 years ago. And a leader before me saw something in me to take on that leadership role, some promise. And I'm really glad that he did. But the ability to connect with patients like Corky and families like Nancy and her brother, and to know their stories and have the privilege of not only visiting them at home, but knowing the intimacy in the way that I do has sort of changed my thought about medicine and what it is to practice medicine. I know things about Corky that maybe he didn't wish me to know. I know things perhaps about Nancy that maybe she wouldn't have shared with another clinician in clinic.
Correct.
I have an understanding of family dynamics in a way that I feel very privileged to know. The pace of home care medicine, I'm very fortunate in the VA. Because we have a lot of protected time to do home care. I also feel fortunate at the VA because our system is integrated. So I have access to the patient's records for many, many, many years. I mean, Corky has a chart that's many years old. And then for me, it's allowed me to take on other leadership roles in our health system. So for me, yeah, it's been career saving, and not in a way that I would have anticipated 10 or 15 years ago, or even when I was training as a resident. And now I have the opportunity to share my passion for home care medicine. I have my opportunity to share it with other learners. For instance, it was the geriatrics fellows, 2 of our geriatrics fellows who took the vaccine to Corky, actually, and who administered the vaccine to Corky. You know, our learners have been really impacted by the pandemic. They haven't been able to make home visits as they would have during the year. And so they were able to get out and see him in his home. And they hadn't been able to make home visits for most of the year. So this is where I see my role as the shepherd, to rally and the troops and to think about outside of the box ways to get learners involved, and to really think about training the next generation. I don't feel old enough to be thinking about that, but I really did start in my career in medicine more than half a lifetime ago. And so I think that we all see changes in our careers that are different than the path we set out on. And I've been really happy to have found this pathway. And I'm looking forward to what the next years ahead bring. But I think home care medicine is here to stay in my career. We've been really involved, our program, in getting the vaccine efforts in home. And then I've been working with other programs, both with the AAHCM and with the VA programs nationally, about helping to get the word out about how other programs have implemented their in-home COVID vaccination programs. So we've been really involved in information sharing.
Well, as an older adult, I appreciate it because I'm getting up there. So it's like, it's gonna, I mean, I'm hoping at least 20 years, but
I mean, eventually we're all going to need the help, right? And you don't have to
it's
be
easy for it's easier for everybody concerned because you're in your own home. You don't have to go out. You don't have to go to a nursing center. It's perfect. I mean, this is what you want to do. I mean, this is how, I mean, that's how I mean, I'd rather be in my home if I'm going to go at any time.
Correct. I think that's what most of us aspire to. And I think the exposure to it for most doctors in training is very limited. And so one of my projects has been taking preclinical students out. So students who are, before they're even exposed to hospital rotations, have developed an interest in home care. And so they're first year students. And before the pandemic, we were taking them out on home care visits, because I don't care what field you're going into, even if you're becoming an orthopedic surgeon or a urologist, if you have done a couple home visits to understand what it looks like for a disabled person to live at home, you will be a better doctor.
Right. I
You will
agree with you.
understand that if you're discharging them from a complicated surgery and they can't transfer themselves out of their bed or to their bathroom, that they need assistance, that maybe you shouldn't discharge them the day after their surgery. Or that if they are on oxygen and they trip over their tubing, that you've done them no service by getting them out of the hospital a day earlier. Because when we're in the hospital, it's really easy to just see a patient in the hospital bed and to not think about what their life is at home. But I think if we're thinking about these patients more globally and what their home environment may look like, then we can think about taking better care of them holistically, and not have them return to the hospital because of a silly discharge error. And we've seen it, right? And then the hospitals are measured on their readmission rates. And we haven't thought about what they're going home to. All they're worried about is throughput and getting them out.
Like I said, the VA, every time I've talked to people, I mention the VA home care to people that are having problems. If they're a veteran, please call the VA home care. Because you have been so wonderful and have stretched his life out. Like you said, who knows what would have happened had he gone home or anything like that. He could have, I mean, he's fallen numerous times, and we just say if he lands on his head, he's good because he's got a hard head. But you know, it's been wonderful. I mean, it's like I said, he could not be here right now if it wasn't for the home care, and all of our family believes that.
Well, it's been such a privilege to take care of him.
Well, he always said he wanted to live to 100. And if he says, I go the next day, I did it. But here he is, like you said, 100 and a half.
Yeah.
So he's doing great.
We'll take it. We will take
it. Exactly. We'll take it, is for sure.